Hello everyone, I'm Dr. Nenshi and I'm the founder of the Chiropractic Wellness Clinic here in Calgary, Alberta. Today I have the great pleasure of talking to Mary. Mary is a patient of ours and has been for some time, and she has a very interesting story about what brought her into the office, and she's agreed to share her experience here today. So I'm just going to ask you a few questions, Mary,
Certainly.
about what brought you into the office, and how did everything proceed with what you came in for, and how impacted your life?
Absolutely. Well, what first initially brought me in was a sign outside that said, Dr. Nenshi, and if you're looking for relief from migraines, um, come see Dr. Nenshi. And I'd been suffering from migraines all my life, and they'd been getting more frequent daily migraines or almost daily migraines. So that meant I couldn't do what I needed to do on a daily basis. I couldn't do just the ordinary things that everybody does in a day. Driving, I couldn't drive. I couldn't do my recreational activities, household activities. So when I did come in, what I asked for was migraine relief. What I got was, let's check to make sure there's nothing else going on. And I was sent for full spinal x-rays and tests, which very much impressed me. So after that, we started treatment. And after the very first treatment, I found significant relief. And ongoing, I just got better and better. And what I was finding was it wasn't just helping the migraines, it was helping lower back pain, my arthritis. It was helping posture. It was helping a lot of things that I had started to take for granted. That was just part of my life. I started feeling just generally so much better.
That's wonderful.
Then, as we were progressing with these treatments, I had a big knee arthritis flare-up. So again, impacting daily activities, especially my recreation. So with the knee issue, what I found was, obviously that was not a quick fix, but ongoing, that too was much relieved and took me back to the way I should have been dealing with my daily activities.
And Mary, one thing that's really exciting about you, and I think is so interesting, is your love of dancing.
Oh,
And
yes.
you are such an active person, and the headaches and the knee pain seem to kind of pull you back from those activities. How did that first start off? Like, what are some of the things that you weren't able to do specifically? And how much time did it take before you were able to get back into the swing of things and back to your normal routine, and loving to dance and enjoying that?
Well, with the migraines, it was immediate. I was able to go back, not worry about having migraines during dance. Dance is a huge part of my life. And without that, it impacts my physical well-being, my emotional well-being. It's just something that I need in my life. So after the migraines were dealt with, I was fine to dance. However, with the knee pain, I simply couldn't dance. And I was worried about actually falling back into depression because I couldn't dance. That is such a big part of my life and my mental health. So with the knee, it took a few weeks because it was not a quick fix, but we persisted. And after a few weeks, I was able to get back into it slowly, progressing slowly, taking it easy. And after, I would say, probably about 4 weeks, I was back to full on being able to dance, being
Nothing
able
had
to
happened.
perform. Yes, just back to normal, and what a relief.
Yeah. And it's a testament to you being so committed to your health and wellness. We make recommendations in our office, and it's always the patient's choice whether they want to follow those recommendations or not. And you were such a stellar example of a great patient, because you followed every one of our recommendations, and as a result of that, you saw the results not just from symptom relief, but functionally things were working better, and they happened so quickly for you. So you should be so proud of that.
Absolutely. Just to find little things like posture. going up and down stairs. All of the things that, as I said earlier, I was starting to take for granted that, oh, well, as you get a little older, these things happen. No, you can feel better and you can function more efficiently. And just every day in and out of the car, little things that you take for granted become easier. And yes, you do have to persist and you do have to be just diligent about doing what you need to do to get better.
And you know, there's often people who are maybe a little apprehensive of coming into a chiropractor's office. Do you have any comments that you can share with people who are considering coming in to see us about, you know, the type of care that they could receive, or, you know, even how you overcame your own fears about coming in for care?
Absolutely. I think a lot of the misconceptions about chiropractic is that it's going to hurt. It doesn't have to. And what I find, Dr. Nenshi, is you are very, very good at asking for permission before anything is done.
Thank you.
So when you want to do a procedure, whether or not the client, the patient, would be comfortable is foremost in your mind. So that is very much appreciated. Nothing is done without permission, and it is, for me, a very comfortable experience.
That's wonderful. Thank you so much for your time. I'm so proud of your progress. I hope that you enjoy dancing and living your life with the vibrancy you have in you, just with all the energy and the love and the passion that you share about dance. I hope that's returned to you many folds over in all aspects of your life. I really do.
Thank you so much. And I so much appreciate what changes you've made for me in my life.
Thank you. Let me hug. Thank you so much.